Good evening, everyone. My name is DJ, and I hope that everyone is having a wonderful day today. Before we get started, I wanted to note that I am reading my notes off of my computer, so from time to time, I'll tend to look to the side just to help me pick up where I started, or if I get lost or whatever. But first off, I would like to state that Social Determinants of Health and Wellness has been a great course. Within the past few weeks, I've learned a lot about health and wellness and just society alone than I ever thought I would. Throughout the course, we learned so many real life problems that we face in society, which includes health, income, safety, education, and skills, and how vital these things are if you want to live the best possible life for you and your family. Determinants of health has also taught me that it is important to know that everyone's health differs by age, race, and sometimes even ethnicity. There were a few topics throughout the course that touched on different races being discriminated against because of their history or skin color, which denies them the chance of receiving the proper income that they may need or deserve, and also the proper medicines that they may need to take to stay healthy, because the doctors feel that the person may be a drug addict or heavily involved in substance abuse. One thing that was intriguing to me was learning that obese children have a greater risk for other health conditions such as high blood pressure, type 2 diabetes, asthma, depression, and anxiety. It was also fascinating to learn that your community has an effect on your health as well. For example, if you live in poverty or a lower class of income, you are more likely to have a severe health condition such as depression and diabetes because of the lack of income that you have and accessibilities to things such as a park or exercising around the park or local playground or things like that, and healthy food markets. So you might not have the best chance of going out and having healthy meals. Having a marketplace that has healthy meals because of where you live or your surroundings. For someone who is in a higher class, however, and is fortunate enough to have a good paying job and a safer community, they're more likely to have a healthier lifestyle because they are exposed to more opportunities than the lower class. So my goal in life is to become a physical therapist for sports. One thing I love is helping people. I try to do as much as I can to help someone out. So that's one reason why I chose the career path of becoming a physical therapist. But also, I wanted to doing physical therapy. I don't want to just do it just for like my local area. I want to do it for people in sports, like basketball, soccer, or football, whatever. It doesn't matter. It just has to be in sports. But one thing that social determinant has taught me to keep in mind as I begin my career is when working with my patients is that health and wellness is vital to your life. So when working with patients, whatever the case may be, I will always remember to ensure that they exercise properly, that they make sure that they intake the proper meals. Maybe I can create a eating program or eating diet for them to make sure that they're living the best life that they can live, and also help them on their weight goals. Make sure that whatever their weight goals, that they achieve it, and that they achieve their weight goals, and that they continue to live a healthy lifestyle. So that pretty much concludes the video. I hope everyone stays safe, and thanks for listening.